It's been months now. My joint aches so badly when I wake up. Sometimes I can barely move. Dr. Joel, I've been waking up with terrible joint pain for months. It's not just stiffness, it's like my whole body is locked up.
These symptoms are concerning, Madam Tan. Let's run some blood tests. In the meantime, I'll prescribe a stronger non-steroidal anti-inflammatory drug to help. But if this doesn't improve, we may need to consider other possibilities, like rheumatoid arthritis.
Rheumatoid arthritis? That's an autoimmune disease, right? My aunt had it. She went through so many medications before finding one that worked.
Yes, rheumatoid arthritis is complex, but treatments have come a long way since then. For now, I will prescribe you with ibuprofen, a non-steroidal anti-inflammatory drug to alleviate your symptoms.
RA is a multifactorial autoimmune disease with unknown etiology that attacks the lining of the joints, causing synovial inflammation, joint destruction, and systematic complications. This disorder affects about 1% of the population globally and affects women more. The first symptoms start from pain, stiffness, and swelling in one or more joints that worsens over time, leading to irreversible joint damage. Medications taken slow disease progression and manage symptoms. Treatments include NSAIDs for pain relief, corticosteroids for short-term inflammation control, and DMARDs that target and suppress the immune system. However, your DNA affects drug response, aka pharmacogenetics. For example, some patients have a gene variant called MTHFR that makes methotrexate, a common RA drug, riskier for them. Others have variations in FCGR3A which predicts how well they respond to biologics like adalimumab. Testing can help us avoid the guesswork. Identifying polymorphisms to understand how genetic variants alter protein function and relate to drug mechanisms, establishing causality. The ultimate goal is biomarker discovery, identifying genetic profiles that predict patient response.
With our MTHFR genotyping kit, it offers precise, reliable genotyping for C677T and A1298C, enabling you to gain valuable pharmacogenomic insights. It's a tool for more informed decision making, aiming to improve patient safety and optimize drug efficacy, particularly for MTX therapy. Dr. Joel, the medication hasn't really done much. If anything, the pain feels worse. I'm still stiff every morning, and it's hard to do simple things like opening a jar or buttoning up my shirt.
It appears that the ibuprofen treatment has not been effective in treating your rheumatoid arthritis, as your recent blood test still shows signs of inflammation. However, recently, I have seen advertisement of a genetic testing kit which may allow me to understand variation in your genetics, which may allow me to look for a better alternative treatment for your condition. Madam Tan, your MTHFR genotyping test kit results are out. I have some good news. It seems your results show that you do not have C677T and A1298C polymorphisms occurring in your MTHFR gene. With these results, I can confidently prescribe you with methotrexate, which is the standard medication for treating rheumatoid arthritis.
The cost per kit is highly competitive, especially considering the potential long-term savings from reduced adverse events and more effective first-line therapy. Regarding insurance, coverage can vary, but we provide all necessary documentation and codes to support reimbursement efforts. We can discuss specific pricing and reimbursement support.